Here are the three biggest questions I get regarding bulging discs and herniated discs. The first question is, how are they different? So let's break down discs. You have a bone here, the disc, and a bone. The disc is the cushion in the middle. On the outside is an annular ring. It's more cartilaginous. It's rubbery. The inside is more fluid. It's the nucleus. We don't want any of the nucleus to push out and extend through the annular. You'll see that with an annular tear or any type of injury to the cartilage. A bulge is when there's no tear in the annular and the inside is pushing out, but it's not extending through the annular fibers. It's just bulging. You can see a little push, like a bulge. That's a bulging disc. A herniated disc is the opposite. It's when the inside, the nucleus material, has broken through the annular fibers. Typically, there'll be an annular tear or an injury to these fibers, which allows the jelly or the inside called the nucleus to push through. That would be a herniated disc. Bulging, it's not pushing through, it just bulges on the annular fibers. Herniated disc, the material inside the nucleus, the fluid, herniates and goes through the annular fibers, typically with a tear. So the symptoms, you can have leg pain, sciatica, nerve pain. You can have that with both. However, much more likely with a herniated disc to have radicular pain, numbness, tingling sensations down your leg. Much more common with a herniated disc because the jelly or the nucleus is outside, most likely to hit a nerve. Can you see these on an x-ray? Another question I get. The question because they went to some other provider and they said they have a herniated disc. When I dive deeper and ask, hey, so let me see your MRI report, let me look at the images. I don't have an MRI. Well, then how do you know that you have a herniated disc? Oh, they took an x-ray. You can't see a disc injury like a bulging disc or a herniated disc on an x-ray. You need an MRI to see that image. MRI shows soft tissue, which would be the disc material. An x-ray can show you the two bones and if there's degeneration, but no disc material is seen on an x-ray. Number three, how would you treat them? Would you treat them the same way? Completely different. A bulging disc, I need to know the size and the location of the bulging disc. Bulging discs are usually more central, in the middle, or paracentral, typically. A herniated disc, well, depends where the jelly or the inside nucleus has gone and depends how big it is. A herniated disc tends to be bigger because it's exploded or gone through the barrier of the annular fibers. The herniated disc could be central. It could also be lateral on the outside. That dictates the treatment on the decompression table. Do we go face up? Do we put your legs in the air? Do we go face down, legs up? All these different positions are possible. We tend to find more unique positions with a herniated disc than a bulging disc. That is the difference in the top three questions I get regarding a bulging disc and a herniated disc.